Hi guys, I am Dr. Monisha. Welcome to a one question at a time series. Let's move on to today's question. Sympathetic supply to the heart arises from which of the following spinal segments? The options are T1 to T5, T2 to T6, T3 to T7, and T4 to T8. These are the options given. So let us see something about the sympathetic supply. So when coming to the autonomic nervous system, we have two. One is sympathetic, that is for emergencies, and the other one is parasympathetic, which is basically secretomotor, that helps in the secretions and in the peristalsis and all the motor things. The parasympathetic. The sympathetic system is basically concerned with emergencies. Okay, the fright, fight, and fight mechanisms. Okay, so coming to the sympathetic system is basically a thoracolumbar outflow. The sympathetic system is a thoracolumbar outflow from the T1 to L2 levels. Okay, thoracolumbar outflow from the T1 to L2 levels, as you can see in this picture. Okay, but you can see in this picture as well that the sympathetic ganglion chain is extending from the cervical to the coccyx level. The ganglionated chain is extending from the cervical to coccyx level, but the input is from the thoracolumbar region. To be more specific, it is from the T1 to L2 levels. Okay, so coming to the split up details T1 to L2, the T1 to T5 is for the head and neck region and for the cardiac, pulmonary, and esophageal plexus. Okay, for the head and neck region and for the cardiac, pulmonary, and the esophageal plexus. Okay, the T5 to T9 is going to form the greater splanchnic nerve, and T10 and T11 is going to form the lesser splanchnic nerve, and T12 is going to form the least splanchnic nerve. The greater, lesser, and least splanchnic nerve is going to supply your abdominal organs. The sympathetic supply for your abdominal organs, and L1 and L2 is for your pelvic organs. Okay, so the T1 to T5 level is going to contribute to the head and neck region and for the cardiac, pulmonary, and esophageal plexus. Now coming back to the question, the sympathetic supply to the heart arises from which of the following spinal segments? Now you say me, the cardiac plexus is going to be formed from the segments T1 to T5. Now going into depth, okay, we will see about the sympathetic ganglia. As I said before, the sympathetic output is a thoracolumbar output, but the sympathetic ganglionated chain is extending from the cervical to the coccyx region. Because it is lying on either side of the vertebral column, it is otherwise called the paravertebral ganglia. Okay, the sympathetic ganglia is called as the paravertebral ganglia. Okay, so we will see about the paravertebral ganglia. See, the paravertebral ganglia is extending from the cervical to the coccyx region. So we have in the cervical region 3 ganglia. In the thoracic region we have 11 ganglia. In the lumbar region we have 4 ganglia. In the sacral region we have 4 ganglia, and the ganglionated chain unites in front of the coccyx to form the ganglion impar. Okay, 3 ganglia in the cervical region, 11 in the thoracic region, 4 in the lumbar, 4 in the sacral, and 1 ganglion in front of the coccyx by the union of the 2 ganglionated chains, which is called as the ganglion impar. So, as I said before, though the sympathetic chain is a thoracolumbar outflow, okay, thoracolumbar outflow, we have the ganglionated chain extending from the cervical to the coccyx region, okay. So you can expect branches from the cervical and the coccygeal region, okay, getting the supply. So what happens is, so this is a basic structure of the cross section of the spinal cord, okay. It's a outer white matter and the inner gray matter, okay, and the spinal canal. What happens is, in the thoracic and the lumbar region, we have an extra horn called we have the anterior horn, posterior horn in all the levels. But in the thoracolumbar levels from T1 to L2 segments, we have an extra horn called as the intermediate horn. We have an extra horn called as the intermediate horn. Normally, how the spinal nerve is formed? We have an anterior primary rami, we have a posterior primary rami that unites to form the spinal nerve. What happens is, now from the intermediate horn, the preganglionic nerve fibers are going to arise and they are going to travel along with the anterior primary rami. Here we have the posterior primary rami, but we have the preganglionic nerve fibers from the intermediate horn, from the T1 to L2 segments, okay. They are going to travel in the anterior primary rami and they reach the spinal nerve, okay. Now what happens is, on either side we have the ganglionated chain, okay. On either side of the vertebral column we have the ganglionated chain. Now what happens is, these preganglionic fibers traveling in the spinal nerve, they are going to come via the white rami communicants. They have a root called as the white rami because it is because it is covered with because it is myelinated, it is called as the white rami. The information comes via the white rami and they reach the ganglion. And from here we have three options. This preganglionic nerve fibers traveling in the anterior primary rami reaching the spinal nerve, now coming out of the white rami communicants, okay, now coming via the white rami communicants reaching the ganglion, can synapse within the ganglion, and the postganglionic nerve fibers can re-enter the spinal nerve and they can go for the supply. These postganglionic fibers are unmyelinated and that's why they are called gray rami communicants. Okay, the preganglionic nerve fibers are myelinated and that's why they are called white rami communicants. And the postganglionic nerve fibers are unmyelinated and that's why they are called gray rami communicants. This is the first option. They can get synapsed here itself, or they can travel to the above or below ganglia and they can get synapsed there. And the postganglionic fibers follow the same routine, but they will travel in the corresponding spinal nerve. Okay, that they can do. Okay, they can travel to the above or below ganglion and they can get synapsed within the neurons there, and the postganglionic fibers will follow the spinal nerve of that level. Okay, or the third option is, this white rami communicants reaches the ganglion but without synapsing, it will go medially. Okay, to synapse with some other prevertebral ganglion. That is a ganglion lying in front of the vertebral column. As I said before, the sympathetic ganglion are mostly paravertebral, but these fibers, Okay, some of the white rami communicants can go unsynapsed and travel medially to synapse within the prevertebral ganglion, and the postganglionic fibers can supply the abdominal organs. Mostly this third option is followed by a splanchnic nerves. Okay, now we can see a nice picture. Okay, so as I said before, here you can see the intermediate horn. The intermediate horn you can see here, and the preganglionic nerve fibers are traveling via the anterior primary rami, entering the spinal nerve, and here we have the white rami communicants entering the ganglion. Either it can get synapsed here, and the postganglionic fibers travel via the gray rami communicants and enter the spinal nerve, or it can travel above or below, the second option, and it can synapse in the above or below ganglia, and they can take that spinal nerve focus, or they can go unsynapsed. The third option, they can go unsynapsed and synapse the so-called prevertebral ganglia. We have a 3 prevertebral ganglia that we will see later. Mostly the third course is followed by the splanchnic nerves for the abdominal organs. So the postganglionic fibers will be supplying the abdominal viscera. Okay, so these 3 options are there, and that's why I am saying that even the sympathetic system is having a thoracolumbar outflow. We can see branches coming out of the cervical region, lumbar region, sacral region as well. Okay, though it is a thoracolumbar outflow, we can see branches coming out of the cervical ganglion, lumbar ganglion, sacral ganglion. Okay, this is because of this setup. Okay, the preganglionic fibers are always thoracolumbar, but the postganglionic fibers can come at any level. Okay, so this is the thing that you have to understand. So with regards to heart, we have cardiac plexus formed by the paravertebral sympathetic ganglionated chain. Here you can see the fibers coming from the cervical and the thoracic ganglion, but the prevertebral fibers are from the T1 to T5 level, as I said before, the preganglionic fibers. So we have a superficial and deep cardiac plexus. Okay, the superficial cardiac plexus, as you can see here, is lying in front superficially in front of the branching of the pulmonary trunk. The deep cardiac plexus, as you can see here, behind there is trachea. So the deep cardiac plexus lies in front of the division of the trachea. The superficial cardiac plexus lies in front of the division of the pulmonary trunk. The deep cardiac plexus lies in front of the division of the aorta, branching of the aorta. So I'll first talk about the deep cardiac plexus. So as I said, the branches, we can see the cardiac branches coming from the cervical ganglion and the thoracic ganglion. Okay, so we can see the cardiac branches from all the ganglion. You can see the third cervical and the first thoracic ganglion is united to form the bigger stellate ganglion. The question for you, stellate ganglion is at which vertebral level? Which vertebral level? So you can see the stellate ganglion, and you can see the cardiac branches. So all the cardiac branches from all the ganglia from the cervical and the thoracic ganglion is going to, first 5 thoracic ganglion is going to contribute to the deep cardiac plexus. The cardiac branches from the cervical and the thoracic ganglion, both the sides. Okay, thoracic ganglion, I mean T1 to T5 level, both the sides is going to contribute to the deep cardiac plexus, except for the superior cervical cardiac branch of the left sympathetic chain. That is the cardiac branch from the superior cervical ganglion of the left side. So it is called as a superior cervical cardiac branch of the left sympathetic chain that is going to contribute to the superficial cardiac plexus. So all the other branches is going to contribute to the deep cardiac plexus. In this side you can see the parasympathetic contribution from the right and left vagus and the recurrent laryngeal nerve. Here we are talking about the sympathetic system, so I'll keep myself to the sympathetic system. So they get it. This small thing you should remember, okay? All the branches from the first 3 cervical and the first 5 thoracic ganglion is going to contribute to the deep cardiac plexus, except for the cardiac branch from the superior cervical ganglion of the left sympathetic chain. Okay, so this is the superficial cardiac plexus. So here we can see the superficial cardiac plexus lying in front of the bifurcation of the pulmonary trunk, and as I said, the left cervical sympathetic chain, the superior ganglion, this branch is going to contribute to the superficial cardiac plexus. And talking about the sympathetic system, okay, when I say plexus, it is formed both by the sympathetic and the parasympathetic. So we have the left vagus contributing to the inferior cervical cardiac branch of the left vagus. These things you must remember, okay? Mostly you don't have to remember all the things. This inferior cervical cardiac branch of the left vagus is also going to contribute to the superficial cardiac plexus. The other branches from the vagus and the recurrent laryngeal is going to contribute to the deep cardiac plexus. Okay, so you can just remember the superficial cardiac plexus alone. Okay, so as you can see here, you can see the pain fibers from the dorsal root ganglion. From the dorsal root ganglion, the pain fibers are going to travel in the dorsal root ganglion. The pain fibers are going to travel also in the spinal nerve. Okay, the sympathetic fibers also is traveling in the spinal nerve. Okay, through the gray ramic communicants is going to travel in the spinal nerve. The pain fibers is also traveling in the spinal nerve. What happens? And that's why we have the referred pain of the heart. Okay, so any ischemia of the heart there is going to be referred pain mainly to the chest wall, where there is dermatomal distribution of the T2, T3, T4 and T5, and the T1 nerve supply. Can anyone name the nerve from the T1? Okay, comment in the comment section which nerve. Okay, so medial aspect of the arm. So we have referred pain to the chest wall and the medial aspect of the arm. Sometimes we can also see a pain in the left shoulder, the cervical and the mandibular region as well. This is because of the cardiac fibers coming from the superior, middle and inferior cervical ganglion. As I said before, though the preganglionic fibers are from T1 to L2 levels, the postganglionic nerve fibers take the corresponding cervical or thoracic nerves, and that's why we have referred pain even to the neck region or mandibular region or the left shoulder region. Okay, this is the basis of referred pain, okay, in the heart. Okay, so this is its importance. Thank you guys. We'll see in another session.